Welcome to Medicine Made General, where real doctors break down real health issues. Whether it's a simple question or a complex concern, we're here to help you take charge of your health with confidence. In each of these short, info-packed episodes, we tackle trending and often confusing medical topics, giving you exactly what you need to know. No jargon, just clarity. I'm your host, Katie Cavanis-Crowley, Communications Specialist for the Johns Hopkins Division of General Internal Medicine. And today, we're joined by Dr. Bimal Asher, the G. William Schlott Professor of Medicine at Johns Hopkins University School of Medicine. He also serves as the Interim Director of GIM and is a dietary supplement expert here to talk about, well, you guessed it, dietary supplements. Welcome, Dr. Asher.
Thank you, Katie. It's very nice to be here.
Oh, it's great to have you. Let's go ahead and get started. Research shows more than half of adults over the age of 20 take dietary supplements, and more than 80% of women over the age of 60 take them. Do these groups really need them?
So that's a great question because, yes, so many people take them. My general answer on this is that if your diet is well balanced, you probably don't get a whole lot out of dietary supplements. And there have been a number of studies to really show this, that we should really be trying to get our nutrients from food and not from pills. Yes, there are going to be certain situations where a dietary supplement may be appropriate. For instance, if you've got osteoporosis and you need to take a little bit of calcium and vitamin D or something like that, it makes sense. But a lot of the herbs and other substances that people are taking, there's very little, if any, data that it really does a whole lot for people.
So it sounds like there's some misconceptions out there. What would you say are some other common misconceptions about taking supplements?
Yeah, I think, when you think about why people take supplements, right? Some think they want to live longer, or they want to try to prevent illness, or they're actually taking it to treat something, right? And that's where there's probably more data or at least more studies done because it's easier to do that way. Or they're going to make, like I said, if your diet's poor, what do you want to do? Well, I'm going to take a multivitamin because I know my diet's poor, right? To make up for something they're not doing. Or, some people take supplements, to make up for something that they're doing to themselves. And I'll give you an example of that. It's, I've got a patient who, for years insists on drinking a case of beer every weekend. And even though he realizes that, hey, it's probably not good for my liver. So he takes milk thistle, a liver supplement, to try to protect his liver, right? So he's causing the insult, but he's trying to protect himself by taking supplements, and there's really no data that that's going to do anything for him. So that's really kind of why people take supplements. And part of the issue, right, is that if you think about medicine in general, right, we have not done a great job about getting preventive medications for people to help them live longer and really do a whole lot about preventing disease. And so people are turning to whatever they can find, and that's over the counter. So.
Right. Well, I think that helps us understand why supplements have become so popular. Going to prescription medications really quick. Unlike prescription medications, supplements do not require FDA approval before hitting the market. Can you explain what that means for consumers?
Yeah, and I think your point is a very, very critical one. And that is, people oftentimes think that because it's sold in your local pharmacy, that it's something that's been approved, right? And we think about drugs, even though the over-the-counter drugs, right? They've all undergone testing and approval through the Food and Drug Administration. The way that dietary supplements work, and this came out of the Dietary Supplement Health and Education Act of 1994, the way their regulation works is that you can market your dietary supplement without it having any data for either effectiveness or safety. And it's only on the back end when people start complaining or physicians start reporting or manufacturers report side effects or problems will they potentially be taken off the market? And so it's a very different thing than taking an over-the-counter drug or a prescription drug, because there's been absolutely no pre-approval process prior to them being marketed.
Okay. So that's for supplements. What about for multivitamins? They're very popular. Do you think they actually make a difference in health? And if so, how?
Yeah. So, similarly, you and I could market a multivitamin, and, put it on the market, and, we don't have to show anything, any benefit or anything like that. And there have been a number of large studies. The Physicians' Health Study was one. The Women's Health Initiative was another that, where they had people take a multivitamin for an extended number of years, and they really found no reduction in heart attacks or strokes or cancer death. The interesting thing, and I think there's got a lot of press not too long ago, is there was a recent study that was done on multivitamins and brain function, and suggesting that it potentially improves memory. Now the study has to be interpreted with a little bit of caution, because they looked at a recall kind of thing over the phone, and it may have shown a little bit of a benefit. And so, do I have a problem with people take a multivitamin? Do I tell them not to take it if they want to take it? No. But do I also think that people should get their nutrients through a balanced diet? I absolutely do. So yes, so multivitamins may be something with memory, but there needs to be much more study done in order to really say that definitively.
What about making it more specific rather than a multivitamin? What about, say vitamin D? Are there any studies that show just taking a vitamin specific, like vitamin A, vitamin D, something like that would be more effective than a multivitamin?
Yeah, and so, it's pretty clear that vitamin D has a role in bone health. But in and of itself, right, yeah, there have been a number of studies done that if you take vitamin D, you don't decrease your fracture risk or anything like that. There's a lot of things. Vitamin D a number of years ago was really a hot supplement to take. Basically because if you look at the normal, what's considered normal, and some of the way that normals are determined is arbitrary. But if you look at the normals, most people are deficient, not, have some sort of insufficiency of vitamin D per the normal range. Now, does that mean, and then there were a bunch of studies done that says, hey, heart disease and lung disease and all these other diseases have been associated with lower vitamin D levels. But the key thing here is that if you start taking vitamin D, do you actually improve those diseases? And studies are coming out now, and a number of studies have been done already to really suggest that it has no effect. And then there have been some further studies to suggest that people taking really high dose vitamin D may be at a higher risk of certain problems like falls, which is odd because originally it was thought that taking 800 IUs of vitamin D a day prevents falls, but when they tried higher doses, it may have caused falls. So it's a very, very kind of complicated process. And so is there a role for vitamin D? Absolutely. If you have osteoporosis, if you have problems with your bones, you want to make sure that you are taking some vitamin D. We do get vitamin D from sunlight, and we tell people, hey, stay out of the sun, slop on sunscreen, wear a hat. And so we're telling you not to get vitamin D, in essence, when we make those recommendations. So maybe taking a little bit of vitamin D is not a bad idea, but is it really proven to do a whole lot for any diseases other than providing a nutrient necessary for the treatment of osteoporosis? Not really. So yes, I think that vitamin D is probably it's a reasonable thing to take because most of us don't get much, but it's nothing that's going to change your health dramatically. So don't expect this great improvement.
Okay. Moving back to supplements, there are memory boosting supplements like Prevagen. Can you explain a little bit more about that? And do these supplements like Prevagen really work?
And this goes back to what I talked about before, is that we can market a supplement without it actually having been proven to be effective or safe. And if you take a supplement like Prevagen, which is advertised as a memory enhancer, and the active ingredient is thought to be this apoequorin, and they'll say it was discovered in jellyfish. It's a very complicated history here. And what you find is that this is a lesson in marketing, right? That they have been very successful very early on, and this goes back over 15 years now, in marketing as a memory enhancer. At one point, they were actually making claims that it could improve Alzheimer's, dementia, improve memory loss from head trauma. Actually, way back in 2012, the FDA sent them a letter saying that, hey, you need to cease making these claims because you have no proof of this. And that also they were suggesting at one point that this should not be considered a supplement. It's a drug. I mean, we don't have this part of the jellyfish in us, right? And so it's really should be considered like a drug. In 2015, there was a class action lawsuit saying that, hey, there's no way that this active ingredient that they talked about could work since it's actually degraded in the stomach. And I'll go back to advertising a little bit. So one of the things that supplement companies often do is they use the term clinically proven or doctor recommended. And that's kind of what happened here. And so what they ended up doing with this company specifically is that they did a study, and if you look at the results of the study, actually it was negative for showing that it had a significant effect on memory. But then they took that and they broke it down into pieces because they did a bunch of different memory tests, and they found one or two tests that ended up by chance being positive, even though some of the other ones were actually negative, suggesting that it had a negative effect on other parts of memory. But they ended up highlighting that, saying it's clinically proven for memory. And so and one of the other parts of this is, well, why are people gravitating towards this? Is because this is a big concern for people, right? I mean, as we get older, we get more and more concerned about forgetting and developing dementia. And so we were looking for something to do. And so you have an audience of people who are just looking for something to help them. And so when you have someone that says, oh, it enhances memory, I have patients who said, well, I'm going to take it anyway because there's nothing else for me. And so people take it. But when you look at the efficacy, it's not there. There have been reports of some safety issues. But this goes for a lot of the memory enhancers that are being marketed, is that they're really preying on the vulnerability of people as they get older.
Thank you for that answer. I feel like you've been touching on this for most of the interview. I guess in my final question to you is, if someone wants to improve their health, can you give us a summary of better alternatives to take rather than relying solely on vitamins and supplements to get them there?
Yeah, absolutely. So if you want to prevent disease, work on your diet. Okay, plenty of fruits and vegetables. Get rid of processed foods. We don't want processed foods. We want natural foods. You want to keep your weight under control as much as possible. You want to avoid toxins like alcohol and cigarettes and et cetera. The newest recommendations about alcohol really did a 180 from what was recommended before, where we were told, hey, 1 to 2 drinks a night is probably okay. It's actually might be helpful for your heart. Well, that's not the case. And if you look at the big studies, pretty much every other disease process, including neurodegenerative diseases like Parkinson's and Alzheimer's and everything, are increased with alcohol use. And so it's kind of gone full circle. And we're saying now that, hey, yes, you can have an occasional drink, but don't make it a regular thing. And so avoiding those types of toxins to your body are very important. Avoiding excesses, right? And, too many carbs, things like that. Avoiding, even you think about, right? I think about even intense athletes as you get older, right? And you want to keep that level of intensity, and you think, well, I'm exercising, right? But if it's really, really intense and it's pounding on your joints and and it causes an injury, then you're down for a while, and that puts your body, in a different place. Managing stress, right? I mean, this is probably a big thing that we underestimate in medicine, is the impact of stress and stress hormones on our health. And so having a regimen to, what makes you relieve that stress? Is it being social? Is it being out with people? Is it meditation? Is it doing yoga? Is it doing something else? That's something to really be able to manage these stressors of everyday life. No matter who you are, you have stresses, and trying to deal with that is incredibly important. And I think social media has made that a whole lot worse. And then, the final thing I'll put in here is sleep. We have very, very good data that the lack of sleep is, number one, common, and number two, has a major impact on our lives. And so if you can work on those things and get those in a good place, and you want to take a supplement, I say go ahead and knock yourself out.
That's a great answer. Thank you so much. Thank you for your time. It was great to have you. And thank you to our listeners for tuning in to Medicine Made General. We hope you found today's conversation helpful. Here at Hopkins GIM, we're not just about advancing medical knowledge. We're committed to making healthcare accessible for all. If you'd like to support our efforts, please visit our website, Charitable Giving at Hopkins GIM, to learn more. Until next time, stay informed, stay healthy.